probably just got a few minutes to catch up on, so I'll be relatively brief. Something slightly different. I'm talking about gastrointestinal infections and diarrhea, which is appropriate just before lunch, I think. Diarrhea, or infectious intestinal disease, is extremely common in children throughout the world. Most of my work is based in Africa, actually, but today I'm just focusing very briefly on the work that we're just starting to do locally. Huge diarrheal disease burden in children in the UK every year, both in terms of hospital admissions, GP consultations, NHS direct consultations, and cases in the community. And rotavirus, which is my favourite organism, is a virus which is the most important cause of severe diarrhea in infants and young children throughout the world, both in developed and developing countries. Each year causing over 100 million diarrhea cases, 25 million outpatient visits, a couple of million hospitalisations, and almost 500,000 deaths in infants and young children every year due to this virus causing diarrhea. Not sure how well you can see that, but this is the offending virus seen in the stool of a Malawian child with diarrhea. Because of the global burden of rotavirus gastroenteritis, two major pharmaceutical companies, GlaxoSmithKline and Merck, have developed vaccines to prevent severe diarrhea. And these are live, orally administered vaccines which are given to infants in the first 3 months of life. I won't go into the differences between them, but essentially one is a human vaccine and the other is derived from a human-animal rotavirus. In countries which have introduced a rotavirus vaccine into the child immunisation programme, there's been absolutely dramatic effect in reducing hospitalisations due to rotavirus gastroenteritis. For instance, in the United States, one of the first countries to introduce vaccine into its schedule back in 2007, hospitalisations due to rotavirus have been decimated. The good news is, 2 years ago, in 2013, the United Kingdom finally followed suit and introduced rotavirus vaccine into its childhood programme. So now every child in the UK at age 2 months and 3 months of age receives a live oral rotavirus vaccine to prevent diarrhea, particularly in the first 2 years of life. And what we're aiming to do locally over the next couple of years is to try and use routine health data sources to estimate both the direct and possible indirect effects of rotavirus vaccination on a range of outcome indicators. So I mentioned in most countries which have introduced rotavirus vaccine, hospitalisations and laboratory reports of rotavirus have been the main outcome indicator. What we're trying to do locally is to go beyond that and use really a wide range of outcome indicators to try and assess the total impact of rotavirus vaccine on the entire burden of disease in a particular health economy in the region. And I think I've just accidentally pressed the wrong button here. There we go. So this is an ecological study using a before and after approach in the area of Merseyside, looking at all ages, not just children, using routine health surveillance and clinical data. And examining those data for a period 3 years before vaccine introduction and 3 years after. So we're looking at hospital admissions, we're looking at emergency department attendances, GP consultations, community consultations in walk-in centres, laboratory detections, and also hospital data. So the entire range of possible places where someone could go if they have diarrhea. And we're looking at changes in the trends of gastroenteritis indicators, the impacts on various services, and so forth. And here's just a quick snapshot of some of the data that we might see using our I work at Alder Hey Children's Hospital, where we can see over the last 10 years or so, there's been these strong winter peaks in rotavirus diarrhea cases. Following the introduction of vaccine 2 years ago, there's almost 0 cases in the hospital. This is expected from other countries, no great surprise, but nevertheless pleasing. And what we're hoping to do is to use this kind of approach across these range of other services to look at the total impact of the vaccine programme. Just like to thank the people who are working with me on this, including from the University of Liverpool, Dan Hungerford, Marinita Ritza-Gamara, John Reed and Neil French, who's in the audience. It's a collaboration with Public Health England through Roberto Ivancos. And I'd like to thank the funders, GlaxoSmithKline, who make the particular vaccine which is used currently in the UK, which is the Rotarix vaccine. So I'll wrap things up there. Thank you very much.